Thank you all for investing your time and interest in helping to understand implementation of structural interventions and kind of what are we talking about. These are things that are going to be necessary for us to really meet the goal of ending this HIV epidemic in the United States. And in order to move us forward, I'd like to bring back our capacity building assistance program manager, Aunsha Hall-Everett, who's going to lead us into what's called a World Cafe. I think you're going to really get a lot out of this. So, Aunsha.
Hey, y'all, and welcome back. And we're glad that you all are still with us as we're closing out this day 2 experience. So as May mentioned, if folks may not know, Aunsha Hall-Everett, capacity building program manager with the California Prevention Training Center. And I'm excited to just discuss around like thinking about structural interventions for HIV prevention and care, and thinking about like using this World Cafe experience for us again to think more big, or to think bigger, better, and more broader, right, around what we can do, right, to leverage our own SI approach. Let me get to this next slide. Here we go. So these are just the objectives of what we're going to do with this. It's going to be a part where we get to engage one another, get to kind of hear from each other, and just think about ways that we can exchange ideas to promote trust building in communities served through structural interventions. And then from there, we want to explore opportunities for meaningful community engagement from both structural and organizational lenses. And I believe the presentations, particularly what Jen highlighted, right, from within Ilona highlighted from New York City Department of Health, right, around like how they were able to like think about community engagement. I think Tim also highlighted more, right, around like what we can do internally to strengthen community engagement. We had Shamir discuss more around like what that can look like to ensure that we're providing that safe space for folks who come into our own spaces, right? So this is a good chance for us to really explore that and have more conversations around that. So just a little bit about World Cafe, just in case you want to know what it is. You know, World Cafe is just this more innovative process for engaging clusters of small groups on conversations about an issue that matters to them. And so in this case, we're thinking about structural interventions to leverage, right, our HIV prevention and care efforts. And then using it as an opportunity, right, for more meaningful communication, coordination, and collaboration to addressing issues. World Cafe offers an ideal way to find out what a community is thinking and feeling about a topic. So this is, again, a chance for you all to exchange those ideas. And so we all can be able to hear like what's happening, have some new discoveries, right? And for us to collectively think about how do we begin to design something, right, that can work down respective jurisdiction, but again, that addresses, right, a whole, you know, the whole in a sense. So this is how the layout of the World Cafe is gonna go. Sorry, skipped it. Why am I going back? Go back, take me back, take me back, take me back, take me back. There we go. Here we go. So this is the layout. So there are gonna be 3 rounds of questions in this World Cafe, right? And after, and we're gonna give you about 10 minutes per round, so not 15 minutes, just for the sake of time that we end at 1, we're gonna do 10 minutes per round. After the first conversation, the host will remain in the breakout room. And we have 5 breakout rooms, which means that you all will be going through 3 of the 5 breakout rooms. But after the first conversation, the host will remain in the breakout room while the participants move to a new breakout room. Each breakout room will be mixed, you know, and it'll be signed by the producer, Glenn. Thank you for this. And we're gonna take their previous conversations with them. So this opportunity for each question to build on one another so the conversation continue to build on each other. So as each question builds on one another, allowing the host at the end of the 3rd question to identify common themes, and then to connect the conversations to provide a sense of for what has been discovered and can be developed between us. So again, in these round of questions or each breakout round of our World Cafe experience, what will happen is that we're gonna give our chance again to answer these questions. We can use either the chat box, or we can also use our voice, right, to share what it is that we wanna discuss. Our host will either take notes or record the conversation, because I think we're all co-hosts, so we have the recording capabilities, but they're gonna be capturing what's been shared, right, in these conversations. And so we want you to bring your voice to this. Think about what is happening, any aha moments, anything that you learned from today that you wanna build on. This is an opportunity for that. But again, we want you all just to be as transparent, as honest, and it's just as fun and as fun as much as possible in this. So just tell you about the hosts. Like I may mention, there are 5 hosts. The hosts are myself, Patrick Piper, Charlie Romero, Duran Rutledge, and Shavar Johnson. And so each of us, these are our responsibilities. It's for us to set the context, right? Again, we want to ensure that you all are understanding the questions that are being provided. We want to make sure that we create a hospitable space for each of us, right? So that we can give voice to the questions, so that each of us are able to give voice to the questions that are coming about. And we also want to encourage everyone's contribution, whether through voice or through the chat box, connect for diverse perspectives, excuse me, listen together for patterns and insights, and also just share some collective discoveries. So that's just pretty much the whole layout and the responsibilities for the World Cafe. Any questions before we start the experience? Okay, if not, I'm going to allow Glenn to get us ready to go into the spaces, but just to let folks know, just to get us started, the first question we'll be asking is around what does a community of trust look like? And the host will begin to give you more of these probing questions that come with that. But the first question we'll be asking is what does a community of trust look like? So begin to think about that. Let's hear your voice when we go into our breakout spaces.
Okay, here we go.
Thanks, Glenn.
Absolutely.
All right, all right. So that was the first round. How did y'all feel in that first round?
Good.
Some good ideas that were exchanged?
Yeah, some good stuff came out of for round one. It was just really quick.
It
by the time I
was.
looked up.
The breakout rooms.
Yeah, I know in my group, John was getting that last little 10-second in, and he made it within that 10
They
seconds.
can
But
participate.
yes.
John.
So what we want to do now is just see, Glenn, how much time do you need to get us rearranged?
Just moving the facilitators back into their respected places, but other than that, we should be good to go. Give me just another couple seconds.
Okay.
Okay.
What I'll do is just get us ready to think about question 2. And so just get us thinking about question 2 is, again, so we talked about what does trust look like, right? Now we're going to ask, how do we build trust between community members and providers? We heard a lot from yesterday and today. I know with the piece with Tim and Coach Humility, and giving the example of Louisiana State Health Department. So again, how do we build trust between community members and providers? So Glenn, whenever you're ready, we're ready.
Okay, that sounds good. And Duran, you may have to move yourself manually, but I'll move everybody else over into there. So just give me this is another 10 minutes, everyone.
All right.
Not yet. So I gotta work. This is what I do. So that you can look all lovely, although you don't look lovely now, but you will be looking like December.
All right.
Okay, now it looks like all the rooms are finally closed.
People coming back. There you
People coming
are.
back.
Hello, hello.
Hey, y'all. Ooh, we had to hurry and wrap that one up. These 10 minutes are going by quick. How did y'all feel in round 2? How was that? Some good ideas are being exchanged?
Yeah,
We're loving it?
loving
Okay.
it.
Okay. Good, good, good. So we're going to get ourselves ready for round 3. And I'm glad that you all are taking part in this and really building on the conversation. So round 3, this is our final round. We want to make sure that we build on this piece, right? And it's a chance for us to think about how do we build trust between communities and healthcare institutions? So we went from the micro and now we're going much larger to the macro. So we went from, what does that look like from the individual perspective? What is it like from a provider organizational lens? And now we're going much larger to like that structural, like health department, healthcare institutions. Like, what does that look like in regards to building communities, building trust between communities and healthcare institutions? Think a lot about what was shared in Tim's presentation around cultural humility. And also think about what was shared during Shamir's presentation. But any of those presentations can definitely capture that. But I know those particular definitely gave some good ahas and great tips of what we can use with that. So Glenn, how are we feeling? Are we about ready?
Just about ready. So let's see here. This is number 3.
Yeah.
Okay. All right. Gonna start putting you guys in. I gotta reassign some of you manually, but here we go.
All right, y'all. Good luck. Question 3.
Wow, all three groups. I want to thank everybody that were in all three of our groups in room 2 because you were all very participatory. I just like to say that word, participatory. It's fun. Everybody was very, very willing to share and engage. So thank you for that.
All right, so we're back, and it seemed like everyone was willing to engage. Thanks for me walking into hearing that, Patrick. So what we're gonna do now is take the time to just do a report back of what was shared in those during those 3 rounds. Our hosts are gonna be ones to share, and if folks want to add into the chat box, feel free to do so. So we're gonna start with breakout room 1, and who was in breakout room 1?
That would be me. I was the host for that room. There are some great insights that were expressed in all 3 rounds. In the first round, there was a lot of emphasis on creating safe places for the clients that they're serving, to really apply culture humility, to really really show a reflection of one's culture and their background within a space, not only structurally, but also in the documentation that's used, not to make assumptions. In the second round, there was a great discussion on how providers are not are only there for a certain period of time. They tend to leave based on money. So how can there be some type of incentive, or how can you make providers a champion within the community? How can you integrate providers into the community to kind of build that trust? In the last round, we just talked about ways to have all public health services not be in their silos, but to come together under the umbrella of public services to be there in a community and have a community presence. So there are some great insights in all 3 rounds.
Sweet, thank you, Shavar. Thank you for that. Appreciate it. All right, host number 2.
That would be me. And so for the question 1, what does community trust look like? We talked about respecting boundaries and respecting confidentiality, involving people who are a part of the community, really understanding what the community's needs are, and really being able to put those needs before the agency's needs. So maybe they're in line and maybe they're not. Follow through, sharing findings with the community, and kind of related to that, transparency and acting on what the community recommends. So actually following through and acting on their recommendations. For question 2, let me get down here. There we go. How do we build trust between community members and providers? Well, finding people who can relate to the community that you're working with, finding community advocates, practicing cultural humility, again, being honest and transparent, and follow through. So a lot of these have similar kinds of things. Being able to serve in multiple languages and having your staff have health literacy. And then also utilizing those community members and maybe getting testimonials from them. Maybe they've accessed services at your agency or from a certain provider, and getting them to share their experience with the community. And then for the last question, question 3, how do we build trust between communities and healthcare institutions? Again, we said finding that shared experience, having staff that reflect the community. So for example, you don't necessarily, if you're working with low income populations people, you don't necessarily want to be showing up in your Armani suit.
Okay.
Just saying, which goes kind of along lines of being culturally humble. And then building systems like fast track systems that can, like if outreach worker brings you in or a DIS brings you in, I'm going to get you through and get you served, on a fast track system, which can help really build these trustful relationships. Great work.
Thank you. And so I was host number 3, and so it was a lot that was shared and the same from our hosts 1 and 2, but some things again around just setting some clear boundaries, to know what to expect and establishing group agreements, self-accountability, clear priorities, not holding grudges and not taking things personal. So those were the things that came from the community of trust, what that looks like to build on what was shared from 1 and 2, as it was similar. Also to build trust between community and providers, just meeting people where they are, no judgment, and explore those commonalities, addressing evolving issues and modifying policies as needed, and providing space for community members to voice concern, and also keeping promises made with to the community with clear expectations and not taking anything personal. And just trust between communities and healthcare institutions. Again, meeting people where they are, but also utilizing like smaller clinics and outreach groups who may already have like a foot or insight within those communities that we're seeking to serve, and being more sensitive to community needs, employing those who we serve in those institutions, and also just consistency in our messages. So that was us with that was all of us who took part in host room 3. So we'll go now to room 4.
Great, thank you, Aunsha. So yeah, there's definitely things that all of you have mentioned already. One of the things that we did mention when we started with round 1 was about transparency, about how transparent are we about the services that we're offering, and maybe challenges that come with accessing certain services, as well as just putting biases aside and offering an open-minded environment to have a free-flowing discussion. And then the next round was just removing barriers when accessing services. Someone mentioned about paperwork or IDs or things that may be challenging for patients or clients to access. So what are we doing at our agencies to make it easier for them to access these services? And also when it comes to community influencers pairing up with maybe religious groups or churches to just build that trust. Sometimes it's also word of mouth or how people are sharing this information, and if they're sharing information, if they're hearing information from someone they already trust, and they're more likely to access services. And then round 3 is just transparency as well, just really of how safe is that space that people are coming into, how welcoming are we making those spaces. If someone is maybe submitting a complaint, is there additional follow-up? Is there a published public statement of how certain information is being processed, or how certain information is being used to make the services better, to improve the services so that people continue to access services and feel heard as they are coming into these spaces.
Thank you, Charlie.
Yeah.
Host 4. And last but not least, Duran, host number 5.
Rounding out the corner. So what does community of trust look like? Well, it looks like the community it represents. So making sure that those who are looking for that trust and building those trusts are actually represented, and also building bonds and relationships, and shows consideration and compassion, having difficult conversations and feeling comfortable in having difficult conversations, and trust that the community knows your services. The community knows your services, so don't oversell and present. So if you say that you can do something, be able to actually do it. So then question 2 is, so how do we build trust between members and providers? So it is, it starts with the individual provider and their skills to make client feel comfortable. So the provider has to be able to make that client feel comfortable. And providing training can help people become more self-aware. And people being self-aware, we're talking specifically about the providers. So building their self-awareness and comfortability in working with communities. Seeing a person as a person first. And being able to relate to those who come in, as far as making sure that you're educated in the thing or the services that you're providing, and building trust, being able to be an ally and an advocate and provide information, and know that if a person needs to access you, the provider, that they have the opportunity to access you as a provider for support and information. And then how do we build trust between communities and healthcare? Forgive me, I have all these little bits and pieces. Having having buy-in from your own institution. So making sure that your institution or your organization has the buy-in first. And also there was a comment in the sense that sometimes it's hard for city and counties to really get crucial staff to fill the positions, and I'm using this word in a culturally humble way, because oftentimes there are civil service positions. In civil service positions, if a person passes that test, they have to hire from the civil service list, and you may not necessarily get someone on staff that has all the skills that you may need for that specific niche that you're trying to fill, for that certain aspect of provider services that you're looking for. And then we had this conversation, and wonderful participant was talking about building trust in rural communities. And sometimes that is really hard to do when everybody knows everyone, or it's a small community, and the fact that there might be some apprehension and fear around seeking testing, getting into HIV care when people that you know or maybe related to might be the ones providing that service. And somebody said this, which was great, and the fact that we're using Zoom now. So it might be an opportunity for providers to utilize technology such as Zoom as an example, to invite those from the community to understand and to learn about the services that they are providing. And that might be an opportunity to reach individuals in a way that is meeting an individual where they are, and the fact that we all have cell phones now. So that's what we had.
Thank you. So thank you to all my hosts. Thank you to all of you all for participating. Thank you for the wonderful producer, Glenn, for being able to move us in and out and all that good stuff. I know that's a lot, because I probably wouldn't have done that very smoothly as he done. But thank you all for that. And again, the moral of the story is, right, thinking about inclusion and equity, right? So how are we inviting folks into these spaces? How are we fostering this sense of belongingness, right? When we inviting folks into this space, right? And also, like, how are we making sure that we have diverse folks, like diverse representation within that, right? Because we're not monolithic, excuse me, tongue-tied. And so, we don't all have the same experiences, right? So we don't want to do that. And when we're thinking about what does like best structural approaches may look like, so it's best to ensure that we are inviting more folks to the table, diverse group of folks to the table, and making sure that we're doing our best, right, to mobilize folks when we think about what changes look like. And the one thing I do love is that the policies that we do have, they can always change. We don't have to be married to those, right? We can always change those policies and practices because things change, right? Everything's changing. We saw that with COVID, and we're not seeing that now, right? That things change. So the policies and practices, we don't always have to be married to those. We can build on those, right? And things that we find to be working, but we don't have to be married to them. So all that to say, just thank you all for participating in this World Cafe experience. And yeah, I'm going to turn this back over to Patrick.